Hi, everyone. We have a great guest today, Dr. Dressler. Dr. Dressler has over 35 years experience in private orthodontic practice. He currently serves on the advisory board of the American Teledentistry Association. He's also an avid entrepreneur. In 2000, Dr. Dressler co-founded OrthoBank LLC, a cloud-based automated accounts receivable platform that is currently serving over 4,000 healthcare providers and is doing over $450 million in sales annually. OrthoBank has made the Inc. 500 and 5,000 list 5 years in a row for being among the fastest growing private companies in the U.S. In 1998, Dr. Dressler co-founded Elite Physician Services, a national healthcare patient finance company. As CEO and chairman, Dr. Dressler grew the business to $200 million in sales before it became the City Health Card in 2003. Welcome to the program, Dr. Dressler.
Thank you so much for having me, Richie. Glad to be here.
Yeah.
And hey, to everybody out there, so I don't forget, Good Friday to everyone, and happy Easter on Sunday. And for the Jewish audience, happy Passover this past Wednesday. And so I hope everybody is healthy and safe, and my blessings to you all.
Yes, thank you very much. Absolutely. So I thought we'd start by talking about how Rhinogram came to be, if you could just tell us that story, because I think it's pretty interesting.
Yeah, no, it's a pretty interesting story. So back in 2013, and I want to sort of walk everybody back to that time frame, it was probably the first wave of millennial moms, okay? And what I began to notice in my practice was that my employees, no matter if they were front desk or clinical, were getting texted by patients that knew them to do everything. My patients were no longer using the phone to call us to change an appointment. They would simply text whoever they knew within my practice and get them to do whatever it was. Wow. And that included some really clinical dentistry stuff. That's like a patient would be at the family dentist. They would see a Panorex with wisdom teeth that might or might not be impacted, and they would snap a quick picture, send it to my staff because the dentist said, hey, ask the orthodontist if these need to come in or out. And the patients simply wanted to do it instantly. And to my knowledge, or my lack of knowledge, it was going on. And my staff were given recommendations like, yeah, they need to come out. I wasn't seeing the x-ray. They all of a sudden had their DDS degree, I guess.
Oh, you weren't even seeing this x-ray and it
was I wasn't
unsecured?
Seeing it. Yeah.
Oh, wow, okay.
They were just, doing what they normally were doing.
Yeah.
And for those that did not have contact to any of my staff members with their cells, they were getting on my Facebook business page under Messenger and sending in all kinds of questions and things. And again, in those days, Messenger did not come with notification. So unless somebody was manning the page, then nobody knew that it was in. And literally, it was days, weeks, months before we would get back to them. And we were delivering.
Also, they were just going to a black hole and they were never hearing from you again?
They weren't hearing from me. It was horrible customer service, things that I really didn't want. And there were two other things that were occurring then. The other thing was we had sent out automated appointment reminders, which were just that, reminders. They were not bidirectional communication. But again, as these millennials began to enter our market, they began to text back. And so, and it went to La La Land. And so when we would call them, they were very upset with us. Like, hey, I texted you back that I was going to be a little.
Oh, they just assumed you're ignoring them because
they assumed we ignored them.
Yeah.
It was horrible. There's literally screaming at my front desk. And so, and then last but not least, what was beginning to occur as well is my staff who had personal cell phones, and let's say I was off of work, it's weekend, or at a CE course or something like that, and there was an emergency that came through, they would text me the whole entire emergency situation from their personal cell phone to mine, exposing PHI and everything else. and
course.
we weren't allowed to store it. So all of a sudden in 2013, I began to realize there is a major problem. And the major problem is now communications. And no longer is voice the preferred method of communication. The preferred method is text, social media messaging, and the like. So I began to look everywhere to see if there was a solution. Being an entrepreneur, as you have described me, and I am, it was what I decided, hey, nobody's doing this. Nobody's even looking at it. I'd like to create a HIPAA-compliant, modernized communication platform that would encompass telehealth as well.
Yeah.
So hence Rhinogram was formed, and it basically gave the patients what they wanted, which was convenience. Why would they text versus voice call? Well, there's just one answer. It's more convenient to do so.
Of course.
And that's why they did. So I would tell any practice listening that you definitely want to modernize your communication systems to give patients what they want, because they're going to figure a way to do what they want anyway, which is what was happening in 2013. Okay, so Rhinogram was created to give patients convenience and to give providers the compliance that they need through everything that we're required to do by law. So the Rhinogram platform brings in Facebook Business Messenger into one place.
Yeah.
It basically will take your phone line and create a HIPAA-compliant textable port, so to speak, meaning we're not going to change your phone system at all. We're just going to take over the texting port to that number, so that
you're keeping the same number, right?
Same number. The practice keeps the same number they've had. So it's really simple to begin getting patients educated to begin communicating with you by text, because the existing patients should already have your phone number in their phone that they would have voice called. But now you can begin to educate them. You can actually text that bidirectionally.
Yeah.
And you can initiate a conversation by text, because again, back in 2013, the way we viewed things, it was doctor-only initiation of communication, right?
Mm-hmm.
Meaning that it was, I'm sending them appointment reminders, I'm sending them birthday, I'm sending them.
Yeah.
So the shift in thinking is, oh, the phone's not going to ring anymore, because we're substituting voice communications with text communications.
Yeah.
And part of the beauty of the platform is that you can move those communications to the right people at the right time. And because it's cloud-based, nobody has to be even in the office they can all be at home, like the COVID situation.
Yeah, perfect right now, isn't it?
Yeah, it is. And I'm going to talk a little more about that later. But I'm trying to give everyone sort of, because I'm not going to go into the fact that this is what I'm using. I'm going to show you how we're doing things, and just know that it's through the Rhinogram platform that everything is occurring. And it's all permanent record, non-editable. So you have got basically a log of everything that has occurred with you and your patient throughout time.
And that's critical. You want to keep all that in your records, non-editable.
That's right.
That's good,
yeah.
So what's going on in your neighborhood out in Tennessee right now?
Yeah. Well, again, it's wild. Like everywhere else. Tennessee, the governor, I don't know, 4 weeks ago said we're closed except for emergencies until the 15th of this month.
Yeah.
Yesterday, which the 15th, by the way, is Wednesday of next week. And so we had scheduled patients because he hadn't changed his mind yet, even though the federal government had changed theirs. And then all of a sudden yesterday we get notification that we're closed to the end of the month. So all the people that we had thought we might see next week,
Yeah.
we're again rescheduling them out due to the governor's notice. So in Tennessee, that's what's going on. I'm sure it's going on in a lot of states. There are some states, by the way, that really don't have lockdown requirements still. And I have talked to a few orthodontists have reached out to me and said they're still practicing. They've never shut down. But that is
Yeah,
the
that just
exception.
recently happened in Charleston, South Carolina over here.
Yeah,
A doctor out here just had to shut down.
yeah. But that's the exception. That's not the rule. Most all orthodontists across the United States are shut down and seeing emergency only types of patients.
So for those few practices that can still see patients, what's your advice for them?
Well, again, the first and foremost thing, if they're seeing patients, is I know when I was seeing patients before I was shut down and how I'm seeing them in emergency only situation
Yeah.
is we've changed protocols of how they actually come into my office. And for the most part, I'll liken it to I've substituted my parking lot becomes my waiting room, not my waiting room. And so what we have done is we text everybody that would be seen on that day, text the night before, basically informing them that we, when they arrive in our parking lot on the day of their appointment, to please text us you're here, but we will text them back when they're allowed to come in. So we're keeping them isolated in their car. We have our door, if you will, from our reception room all the way back to the open bay area open. We've propped it open, and we text them back, you're ready to come in. I'm sending an assistant out to get you. The assistant holds the door open. And by the way, we ask that only the patient come back, type of thing. If it was a new patient and a parent was going to be with them, then yes, we do say the parent can come with new patient, meaning for those offices that are really open.
Yeah.
And then you bring them back, do whatever. But we would, let's say, bring an existing patient all the way back to a sterilized chair. Even though I have 6 chairs, and when I was going, I had 6 people scheduled every 15 minutes.
Yeah.
We did not bring 6 back. We did not put them side by side. We put every other chair. We brought back 3 at a time, did our work, escorted them back out. They touched nothing. And we told them that we're going to be making their appointment before they leave our parking lot from their car, and they're texting with our office to make their next appointment at whatever time. If they had bills to pay, mom's in the car. She says, hey, I've got a bill. I'd like to pay it. We send them a link to pay. We have text a text to pay link.
That's
and
nice.
that's part of the platform as well. So it's really nice. Mom's out in the car. She's paying a payment of some sort, and that she might be behind on or whatever. And then we're texting her when the next appointment is. So again, and then re-sterilizing chairs. Nobody's done anything. And by the way, I forgot to tell you, we do also give them the warning to say, please reschedule if you've had a fever within the last 72 hours or are coughing. We would prefer not to see you, and we'll reschedule you when we send to stay in the car in the parking lot. That is all sent to them the night.
So you have you have like a template maybe that you're sending them, so you know you're saying the exact right thing every single time.
Every single
getting
time.
Lazy. Yeah.
Yeah. No, and that, I'm glad you brought that up. It is a template, so it's very, very simple. So you take a template, you blast like 50, 60 people, if that's how many you're seeing. Now we don't even have to do that. We've got 2-3 people once a week or something for emergencies there. So at any rate, that's how we handled it. And believe this or not, we ran more on time doing it this way when we were seeing a full schedule
Yeah.
than we did when we were seeing 6 at a time. And I would almost tell you that, again, you can only imagine, because I, being the doc, I'm in the back and I don't see really what goes on in the front. But I can just imagine people come in, they go to our drink area with juice bar and coffee, and we've got games, so they start playing, and they go to the bathroom, then they come back and we have a brushing station. So all of that is no longer happening.
Yes, I
Okay.
gotcha.
And so again, they're coming from their car all the way back. You treat them, you move them out. There's none of this other stuff that's going on. And even though we were seeing them 3 at a time versus 6 at a time, we were actually more efficient and more effective because of the process. And we ran right on time. It was amazing. And my staff said, even when this is over, potentially, we would love to make that the protocol, because it helps in all kinds of ways.
That's
So,
interesting. So it's super efficient, error proof, and gets
yeah,
the door.
and again, templated. And I also want to tell folks out there, what are we doing now, type of thing. And this would
Yeah.
be applicable to everybody, whether you're quote unquote closed, seeing emergencies only, or whether you're truly open. But if you're truly open, that's how I would work the patients in and out of your place.
So if you're not open, what are your suggestions?
Yeah. Well, if you're not open, I would definitely market yourself to your market that you are open, but you're open virtually. Okay. Meaning, I think they need to know that they can get you virtually about anything. Because if you say you're closed,
Yes.
and to certain people, that means you're not available. Okay. And I truly don't believe you should say that. If you say you're open virtually, then, oh, cool. Then how do I get a hold of them? Or in my case, my patients know they can text and send me photos and different things to my practice. But that's what you want to be able to let them know out in the marketplace there. You also have the great ability to pre-screen. And again,
Pre-screen. What do you mean by that?
well, if somebody thinks they're an emergency, then they text in, hey, I've got a problem. You basically can say, can you selfie me that problem? And you triage it. Okay. So again, if you think of me, I'm at home. Each of my staff is at home. Everyone is logged into Rhinogram. So everyone is actually seeing this text come in. And as soon as it comes in, everybody knows, whoever gets it first. I'm not sitting there watching Rhinogram every second of every day, but we have notifications. And so I wear an Apple Watch, and a notification will come across my watch that says, hey, you have got something to look at in Rhinogram, because they will route that message to me to pre-screen them. And I basically will look and I'll make a decision. Is this something that we need to set them up a time to come in or not? If we do make that decision to come in, the other beautiful thing is we have internal communications built within the platform, much like Slack, where you can @ somebody. So what I would do is @ a couple of people, let's say a front desk person and an assistant, and say, tomorrow we're seeing an emergency. You may have seen this come across. I do need you to come in at this time. We're only going to be there a short period of time. We'll get ready for this. As you can see, they either had a bracket off that had a chain that was pushing a tooth out of place that we're going to have to put on, or they've got multiple things off and teeth going everywhere, or a steel wire that's bent to Kingdom Come and we need to replace it because teeth will go everywhere.
Yeah.
And they're in a lot of pain because they bent that wire in some shape or form.
So all of this is just via text. So your amount of time actually getting this all organized is very limited, and it's not taking a lot of time out of your day, but you're making sure it happens tomorrow and it happens properly. Everyone comes in and does what they need to do.
No, that's right. And our existing patients, let's say existing braces patients, we're still engaged with them. I think it's very important. And we would send out, if they were, quote, scheduled that week, we send them out again, a templated text saying, hey, this visit is going to be virtual. We would like for you to send us these 3 pictures of your teeth. Dr. Dressler is going to evaluate you, and then we will set you up an appointment for an in-office visit. Now, once I do that, I'm actually, quote, telling them, hey, you're doing fantastic. My receptionist is going to be reaching back out to you to schedule your next in-office visit in 10 to 12 weeks. If you've got any problems, please selfie it to us. Please stay safe. Thank you for flattening the curve. All of those types of things. So they really feel connected. Now, you talk about saving time. I'm doing these in 45 seconds or less. It's a template.
Yes,
okay?
Exactly.
All right.
It still feels like a personal connection. And
that's right. And then I am routing that patient after I've given them my thoughts. Some of them are emergencies. Like I said, hey, you've got a bracket off and a change and a tooth squirting out and it's going up and all of that. I need to see you tomorrow, But then most of them are not. And most of them, again, are 45-second type of communications.
But even the ones that do end up becoming a necessary appointment, you can just add everyone that needs to be in the conversation and get it.
That's exactly right, which is what's really cool about the platform. Yeah.
So what do you think the new normal is for practices right now? I mean, telehealth is already starting to come down the pipeline, but now it's kind of been a catalyst. Just going hyper speed. Everyone's got to get up to speed now or they're just going to get left behind. So what is it?
Yeah, well, I think even when we come back, I mean, the new normal right this second is how do doctors, communicate with their patient base? And by the way, I think that's the number one area that you need to communicate with because they're still paying you monthly, and that can be a revenue stream that stays alive. What you don't want to appear to that patient base is that you're ignoring them. And whether you text with them or whether you're making voice calls, whether you're sending them notes, I don't think it matters, but it is engagement. But the reason I like the text and the pictures is they feel they're still being treated, okay? And so if I'm being treated, then I don't feel as bad about having that monthly payment each month coming out of my account.
Oh, absolutely. You're giving them very obvious value for the service that they're.
That is correct. So new normal now is how do I virtually treat or see or check in on my existing patient base, and then how do I keep my entire staff involved in understanding, assuming that you're still employing them. I have chosen to employ my staff. Again, this is a personal decision for each individual doc. I'm not here to say what any one person should do. It's whatever the best for your situation. To me, that's what you should do, So whatever's best for your practice is what you should do. But if you have chosen to, quote, furlough them or keep one or two of them, it doesn't take many people to handle what I'm just describing. They can handle it all very, very easily and can be, again, informed of what to do. Because I would assume if everybody is at home, then and you have a phone line, you are going to be transferring that phone number to be answered somewhere else there, and they could be overwhelmed with phone calls. Again,
Absolutely. And I know you can keep a lot of the staff on unemployment if they're getting it now. They work for you for, every state is different, but that can be a very short amount of time per week they can work with you. But if you have a really efficient process like this, you can schedule that out for the team throughout the week, and they could be getting the unemployment, but also still getting some work done that's really valuable.
Yeah. And to me, the biggest problem, or I won't say problem, but the challenge that we're going to face, and I'm beginning to realize it more and more as time goes on, is how do we handle the first day that we open back after being off all this time?
Absolutely.
And I think it's very, very easy for us to be able to schedule regular visits and scatter them out. That's not who I worry about. But if you're a practice like mine, who's been around for a long time, we're doing debandings virtually every day.
Yeah.
Okay. And these people, when I look at a month backlog or 2 months backlog of debands, every one of these want to come in tomorrow, the first day you're open. They want them off. And how do I handle, and how do we handle the backlog of the patients wanting them off? And then how do we handle the potential new patients that you might have been able to put on your schedule that you said you would see when you reopened? And I'm beginning to think that my first 2 weeks or 3 might be only debands and new patients.
Mm-hmm.
And I might see regulars on out. Now, I'm giving you top of mind thoughts. I haven't decided.
Yeah.
I'm having to think about it now, because it's more and more and more and more. And who do I need to service? Who can I put out longer? I've been able to triage, if you will, the braces cases to see where they are in treatment. Who can I push out further to open up my schedule for who wants to see me the most now? Because I've got a feeling, we did and do a minimum of 2 debandings a day,
Yeah.
And sometimes 4. And so when I think about how am I going to put all of these folks in as fast as possible, then this is how I'm thinking about potentially doing it.
So we could go into the patient management systems and kind of analyze that data now to really work it out and do some sort of scenarios.
Right.
You need to get a grip on the schedule. It makes a lot of sense.
Yeah.
So when we're talking about this modernizing communication with patients, how do you think that can help combat the direct-to-consumer services?
Yeah. One, I think orthodontist or non-direct-to-consumer practices, so it could be DSOs, it could be whatever, it could be individual practitioners. You must understand what direct-to-consumer marketing is doing to you. It's trying to define you. It's trying to define me, the individual practitioner, and is defining me. Forget trying, it is defining me. And I can't, me personally, I don't like that at all. I don't think anybody else should define who I am in the services I provide.
Yeah, and have millions and millions of dollars to push that message to whomever they want.
Yes, and that's what they're doing. And for you out there who may not understand what I'm talking about, every message is saying to you, no matter who the direct-to-consumer company is that's doing it, the message to the consumer, to the public, is that to see an orthodontist, it is very inconvenient. It's monthly visits, it's a lot of your time, and it's extremely expensive.
Yeah.
So they're pushing convenience and cost, and they're basically defining all orthodontists as this way. I will not allow them to define me this way.
Mm-hmm.
So that's why I think digital marketing allows you, the individual practitioner, or you, the DSO group, to go out there and market direct to consumer as well in your local market, and be able to say, I'm as convenient, I'm as affordable on certain case types. But because they're going to be able to send you pictures, you understand if it's an orthodontic retreat, 1 or 2 teeth, you can do it 6 months or less. You can do it for a competitive price. And if enough orthodontists are out there defining themselves in the market, and especially somebody like myself that has a brand name and has been in the market for a long time, they have more power than anybody else. So their name is known in the market. They need to be out there defining themselves in a different light than what's being defined by someone else. And that's what it gives you an opportunity to do just that, you know.
Yeah, so you can use these digital platforms like Facebook, Google Ads, Pinterest, whatever, and they're really not that expensive as long as you have the ads and the campaigns to run them, and you can get your message to thousands and thousands of people for a very low price. So I think that's great. And if you have these modern communication channels like Rhinogram, you're doing virtual consultations, you're doing things that truly differentiate your practice, you're showing that added value when you're communicating with these customers. You're showing why you have more value than these other direct-to-consumer services. So it helps justify if there is a bigger cost. And you need to kind of justify that. We can't let the practices be viewed as commodities right now. We can't let the commoditization really threaten us.
Right. And actually consumerism is what the biggest disruptor is, because understanding that the population of people that we're dealing with today, and it's only going to get larger, are millennials, Gen Zers, and these people grew up texting. They did not grow up speaking on the phone. As a matter of fact, a lot of them have difficulties speaking to you.
Absolutely.
And, yeah, I have a daughter, 23 years old, and it's amazing to me that I try to voice call her and she'll never answer. And when I text her, she answers immediately. And when I confront her with it, she says, Dad, you don't understand. I'm actually in conversation with 5 other people with you. And so if I answer a phone, I can't stay in conversation with those 5. So I'm basically interrupting her line of communication by calling, where I'm just a part of her communication by texting. And I would tell you,
that's interesting. Okay.
Yeah. And I would tell you that it occurs in your practice the same exact way. You're going to be able to communicate with 7 to 10 different people in the same amount of time as one voice call or one video call.
Yeah, so the practice is achieving the efficiency of this new communication model.
That's right. So again, I want to think about whether you do virtual this or virtual that. It doesn't matter. What is important, if you choose to embrace it, fantastic. If you choose not to embrace it, that's okay too. But I would embrace modernizing your communications, meaning embrace text communications over voice, because that's equally as important when it comes to convenience, because patients will want that convenience over somebody who doesn't provide that convenience.
And I think even people, older generations, are using text more. I know my own dad, when he discovered you can speak to the phone and it types text and then texts you, all of a sudden he started texting me because it was easy for him. and he didn't have to pick up that phone.
Yeah.
So we know millennials love to be online, but with COVID, do you think now older generations are going to be more comfortable with this type of communication where maybe a few months ago they weren't, it wasn't really in their comfort zone, but they're kind of being forced to? Do you think we can help attract more of those type of patients who are looking for older new patients?
Yes. Yeah, of course, everybody's forced to do virtual everything. There are more virtual doctor visits going on. There's more virtual, I'm talking about physician follow-ups, and
Yeah.
especially with the older generation. I know my father, who's 87, maybe 88, I guess he'll be 88 May 7th,
Awesome.
and my mom's in her 80s as well. They've both had telehealth visits for the first time. They actually loved it.
Really? They loved it? That was their immediate reaction?
Yeah,
That's interesting.
they loved it. They did it from a desktop, where they were able to go to a link and click the link, and the doctor, they were in a waiting room, virtual waiting room, and then the doctor came on and talked to them. My wife did hers, and for whatever reason, the internet wasn't working well, so the video kept hanging up. I mean, getting frozen, and so she ended up doing hers without video, and it was with voice and text and pictures, and they were able to do the same thing. And in today's world, the docs are getting reimbursed the exact same amount of money by insurance company. This is medical providers, as if it were an in-office visit. And so what I think is happening, you ask about the older folks, yes, they're engaged, but they're also engaged and had started getting engaged because the only way they can speak to their grandkids is through social media. And so they had to get used to, the Facebooks, the Instagrams, Snapchat, TikTok, you name whatever it might be.
TikTok, that's coming up. That's my advice to many practices out there.
Yeah, no, that's right.
Start learning about it.
Those types of services are where the grandparents are on. Really, the generation, believe this or not, that is the least technical is going to be really your 55 to 65-year-olds, meaning the grandparents, and not to say these folks aren't, the grandparents have gotten on board because of the grandchildren. The folks, the 55 to 65, 70, or maybe 50 to 65, their emailers are their preferred medium, if you will. Now, not me, I'm in that category. I'm a texter, social media messenger is myself.
You're a bit of that makes sense. I bet that'll change though after all of this, because just everything is being forced to change.
No, I do, and that's why I said I think modernizing your communication should be something that you would want to do, so that again you can easily communicate with patients, and you can do virtual check-ins. It's not a virtual consult. Again, for those docs that, and when I use the word consult, I'm thinking new patient exam. It's not a new patient exam per se, but it is a follow-up to an existing patient where you have x-rays, you know what's going on, you see pictures, you can make determination, and you can triage it to the extent that if you need live video, you can have live video and do live video exchange. But you'll find through triage, it's going to be like you use your cell phone today. Most of my communication is text. I have some voice and some video.
Exactly.
Less video than voice, and less voice for sure than text. So I see that's how this would evolve. And again, all of that capability is built into our platform. You know?
And I mean, is it fair to say that the biggest efficiency gain is really through that monitoring phase with the patient journey, not really the initial consultation as far as time saved, energy saved?
Yes, absolutely, because you decrease the number of in-office visits when you can monitor them from afar. And in-office visits are running approximately, I mean, this will vary practice to practice, but on average about $100 when somebody walks in your door. That's the cost. So
Yeah.
why would it be that? Well, you know, you've got coffee station, juice bar, you've got video games, you've got front desk time. You know, they drink and eat you out of house and home when they bring in a herd of kids with them.
Yeah.
And a lot of times those kids, they'll go into the restroom, clog your commode, and the next thing you know, you're calling a damn plumber. And you've spent $350 to do something that you might could have handled from their home if they would have texted you a picture of what it was that they came in for a, quote, perceived emergency. And then obviously you've got assistant time, doctor time, sterilization, gloves, you name all the little things, it'll be $100. I will tell you in 2019, I was able to decrease my expense structure 16 overall percent. So my total expenses decreased, and the vast majority of that is keeping those people out of my practice that didn't need to be in the practice. And I see that as part of the evolution of change that's going to occur after COVID is people are you're going to want to keep your chairs available for the meaningful appointments that you must see, and begin to transition to what do I have to see when versus how we're doing it today. And whatever you can do from the patient's home or the comfort of their couch or wherever they might be, they could be on vacation for that matter. As long as you're able to monitor it, you're in great shape and bring in what you need to bring in when you need to bring it. But let the wires work. I mean, I was sharing with you before this podcast, there's not an orthodontist out there that either during residency or during practice that hasn't seen a patient that has disappeared from your practice for 2 years, shows up, and lo and behold, nothing broke. The wires are still in perfect, and the teeth are as gorgeous as they've ever been in their lives. And we as orthodontists feel that we must tinker and do things, but maybe the reality is we don't need to be in there as much as we think we need to be in there. We're doing it to potentially create value of why patients are paying us what they're paying us to be treated. But the new generation coming up, I think, will be more accepting toward less visits and more virtual visits, because that is their world, and that is the world that they're in. And as mentioned, there's 80 million of those folks in the United States. They're the largest consumer population today.
So it's fair to say if you don't have some sort of telehealth solution, you're really missing the boat on a lot of the millennials out there, and probably your competition's kind of taking a lot of that share.
Yeah, absolutely. I mean, I really do think what the biggest thing that we'll experience is how we acquire new patients. More acquisitions going to occur online than ever before, in my opinion, and especially 5 years from now. I still think we're in a hybrid state. And I think that we still have 40-50% of our patients are traditional, and the other 50 to 60% are your millennials. But as time goes on, 5, 6, 7, 8 years from now, they're all going to be millennials, and that you're going to have acquired lots of them online. Again, 60% of my practice in 2019 was acquired online. You know, that's how I got it.
60%.
Yeah.
And if you really can gain these efficiencies and you can get more available seats during the day for someone who just wants to have one office, the doctor just wants to have one doctor, one office, and they're fine with that. They just want to maximize the profit of their office. you can then fill those seats with more people as you grow, and you're not forced to open another office if you don't want to. I mean, that seems
Yeah.
really valuable.
Well, what happens is you see less patients per day, so it doesn't require as many employees. You don't have to spend the money to have as many seats, meaning whatever your number is, it
Yeah.
is. And to me, the overhead, it goes way, way, way down. And to be quite honest, I probably have got twice as big an office as I need today with the modernized way of communicating and becoming more efficient and more effective, even though I'm seeing the same or more patients than I would have seen traditionally.
So
And
you could keep your whole team, see double the amount of patients, or you could have a mix and have a little bit smaller team, but still see more patients, maybe just
that's correct. That is absolutely correct.
So how do you feel the future, what do you think the future of oral care is going to be, the future of telehealth in your
I
opinion?
think it's going to be all of medicine and not just dentistry or oral health. And that is, again, what I just described. And that we're going to learn better when people need to come in and when they should come in and when they shouldn't. And the things that you can accomplish by keeping the patients at home, you'll be able to accomplish. And technology will advance as well. I mean, I truly believe that, and I know I've talked with some of these folks like at Mouthwatch. Mouthwatch initially came out as going to be a home device, home camera, intraoral camera for the patients. It was going to be very inexpensive, and it was going to be Bluetooth to whatever technology. Well, no patients. I mean, they didn't have a market at that time for that, so they began to use it attached to the computer, the actual camera, and their cameras are inexpensive. I believe they're between $200 and $300 for their system. I mean, it's a nice intraoral system, but it's used in teledentistry to go out to the rural areas with let's say a hygienist or a licensed assistant who can do things. They then, if you will, scan with their mouthwatch camera the teeth, but it's being video broadcasted back to a pedodontist or a dentist in the suburban areas, and they're telling the assistants what to do. Now, they're not filling a cavity, but they're saying, yes, you can seal these teeth here. And then once they've sealed it, they'll go back over the sealant, and the doctor in a remote location looks at it and verifies that, yes, those sealants are good. And now we're delivering care out to rural areas and protecting teeth of youth. And again, it's a pretty cool system. But I do feel, again, next 5-10 years, these cameras will go back out. Somebody like Mouthwatch, who thought about this really before its time, will have Bluetooth to the consumer, and maybe it'll be in the $50 or less range, and it'll be just something they have like a thermometer, and they'll be able to use it and have sterilization. It's not disposable. They'll have sterilization sleeves or whatnot, and then they can Bluetooth their teeth to you, and you're going to be able to have a much more accurate, better record of what you're looking at. And I think for those orthodontists who aren't quite as comfortable looking at still pictures or even on a live feed with Skype or Zoom or whatever, they can't really get to see what they want to see, then this is going to really blow it up, and you're going to be able to it's almost like they've got a scan in there that you're looking at. So it's going to be pretty cool,
Yeah, I think self-diagnostic tools, self-monitoring tools in general will become something that is in a lot of homes. I mean, imagine if we could have just diagnosed everyone with COVID from home in a few days, how much different this would look right now.
Yeah. And as a matter of fact, Richie, I don't want to I want to share with you that I did talk to the government about doing just that with our platform, because we could have, this was my big vision of COVID because of how our platform was done. When the first case got diagnosed, we have a lobbying group that we contract with, and they went up there, and I basically described through the emergency broadcast system that they could beep everybody's cell phone, give them a 1-800 COVID number and say, hey, we've got a healthcare crisis on their hand. We would have pre-built a team that could log into the platform, because again, it's cloud-based.
So they could just be at home ready to go when, like a National Guard situation.
That's exactly right. Okay. You would have that, and then you would have your initial triage team that could be set up all across the country. Then you would set up state teams that you would have, and then it would go down to local teams where every county, or city would have their local team. And if you could build that, then you route the message to the right team after it's triaged. You've got a record of who it is. And it had gone to the extent that I had a guy that was going to be able to deliver 250,000 couriers. So why would we need those people? Well, when you could diagnose those that could be quarantined and didn't need to be hospitalized, they're at home. You then have your local person communicating with them on a daily basis to make sure they're not getting worse. And again, through text. And then you would say, if they needed anything, you'd say, hey, we've got a courier service. The government would protect those people, and you'd have them as young people, so if they got it, you're not risking their lives, most of them. And they would be your courier. But even better yet, you now have these couriers that can go when these people are healed and go and collect plasma. And then you can inject that plasma into folks who are getting sick to get them well quicker. And these couriers would be trained to do all of that. And to me, we could now contain something like this. And guess what? We've got a record of every single person that would have texted in with symptoms. You're not going to get what happened today. You wouldn't get where they get busy signals. They go to emergency rooms and, you can't have the test even though you're having symptoms, because you don't have anybody who's written it out for us. And we just had a case in Chattanooga that was written up about where a guy actually had it, was told he had it by his doctor virtually through video, but couldn't get a handwritten prescription from him and so subsequently he went to get his test and they wouldn't give it to him. And I mean, that's ridiculous. So I had to go to the emergency room, infect everybody in there, and to get his damn test. I mean, it's ridiculous. But anyway, I didn't mean to get off tangent.
No, I think that was great. What you're saying, I believe what you're saying is going to be the future, because it seems so obvious. In the days of Amazon and all these amazing supply chains and all the capability in telehealth and the technology we have, there's just no reason not to have a system like that. And it requires an exponential amount of people to reach everyone at the same time. You have to have these systems in place.
Right.
We do have one question from Hilton. They just wanted to know if Rhinogram's going to be coming out with video capability.
Yeah, absolutely. You heard me say that, and it's going to be it should be to everybody by June 1st. It is in alpha right now. It's going to be really, really cool, by the way. The patient doesn't have to log into anything. What's going to happen is the doctor or staff, whoever, is going to send the patient a link that all they have to do and say that this is their appointment time. They click on the link. The link then notifies the practice that somebody's in the waiting room waiting on them, and the doc can then just, boom, log right in from Rhinogram and be with that patient for that period of time. So it's going to be real simple and easy. Again, Rhinogram's belief system is zero barriers between patients and the provider. And that's why There's no app to download for the patient. There's no portal to log in. They simply do what they already know to do. And that's why we didn't want to create another barrier to adoption, because what people don't realize, to log into a portal or to download an app, that's a huge barrier for people to do.
Absolutely.
And I hate to tell you, I mean, it's not as much orthodontists, but because we don't deal with the lower socioeconomic as frequent, but the lower socioeconomic, which is 30 to 35% of the United States population, has no internet access. So they can't log in to.
Oh, that is such a huge point. I always forget that's true.
You know, we live in this world thinking that everybody's got the same technology we do.
Yeah.
The reality is they don't. So being able to text with them is phenomenal. We have a pediatric practice, the largest Medicare practice in the state of South Carolina, that quadrupled their engagement with the lower socioeconomic by texting versus trying to get them through voice.
Wow.
It was amazing. And their costs have gone down because of the enormous time spent trying to just call them and them not answer. And of course, if it's coming from a back number, not a number that's in their phone, they're going to think it's a robocall and they're not going to answer.
Of course. I do that all the time.
Yeah. So
Hilton had another question. What are the groups that you use in patient messages and in team messages?
Oh God. I've got, you name the group, I've got it, but let's just start with basic groups that I use with my patients texting in, and then I'll tell you about team as well. But patients are going to have the obvious groups. I'm going to have an appointment team, a group. Okay. I'm going to have an insurance financial team, because my insurance coordinator and financial coordinator are the same person. Now, if you have multiple, you just put them in a team and you route the message to the team, and whoever's available can begin to answer. I have a RhinoPay team, I guess. Well, I guess if you've got RhinoPay, it's automatically on there. I have a clinical team that will triage some of the clinical questions, that's made up of licensed personnel that could actually tell and make the determination, is it something that Dr. Dressler needs to see or not? Mm-hmm. And then we see in bigger groups, not just one doctor, but you've got a doctor team. And in my practice, that team is just me, so they know to send me those types of things that need to be handled legally by the doctor. I do have I guess this will move down in, those would be the main things that I have. I have groups. Let me go back to the patient, because I do have, I have patient groups, and those patient groups consist of these. I've got an aligner check group, meaning these are people that I'm treating for aligners. In every 2 weeks, this is just me. You can set your protocols how you want to set them. We ask them to send the pictures of their aligners in and aligners out every 2 weeks. I evaluate those aligners and I tell them, yes, you can move to the next aligner. My protocol is this. I have them in for the exam and scan. I have them in for the first visit, which I try to put all attachments in slenderization. I give them their first 2 aligners, and every 2 weeks I have them text me pictures. If they have done well after 4 weeks, both the aligner 1 and aligner 2, we FedEx them 4 aligners, and we still see them every 2 weeks. Okay, if they did well with 4, I then FedEx them 8. And we keep going until I'm done. Okay?
So you're slowly building trust to see if they
that's right.
That makes sense.
And if they get off, if they're and I don't go past 8, I don't ship them any more than 8. And again, I tell them how good they're doing, and it takes me literally 45 seconds to know. But when they're in for that first placement, this is critical. We spend time teaching them how to selfie with the aligner in and the aligner out and what we want, okay? Because if you train them, it's sort of like how you spend time with toothbrushing.
Mm-hmm.
You know, here's how you're supposed to brush. Here's how we want you to take these pictures. This is going to give us the best. We let them practice. They show us on their phone what they did, and we say yes or no or whatever. So again, we're training what we're wanting to keep as many people out as possible. So aligner checks. We have retainer checks. Okay, so I'm out of braces now, and I will physically see the patient the first time, let's say 6 weeks, 8 weeks, whatever it is, after we've taken the braces off. We'll do the final records then. I'll check their retainer. And at that time, we ask them and the family, would you like your next visit to be a virtual visit, or would you want to come see me?
Also, you're giving them the choice. What are the percentages of what each one would you say?
Yeah, because again, I don't know if they're one that value coming in or one that doesn't value. So again, to be able to separate without forcing everyone into one category or the other, we're giving them the choice. So that's what we're doing with them. I've got it now because of COVID. I've got braces checks. That's another group that we are putting all of the people that we're doing braces checks into that group.
But you already had these other processes, so it's sort of a template. You just had to apply it to braces.
That's right.
Yeah.
Now then, those would be, again, my main ones that I would have for patients, okay? Oh, wait. Two very important ones that would be new patients, okay? Or we call it potential new patients.
Sure.
We have a category for them. So somebody's texted in brand new, sent us pictures. They've asked a lot of questions. They still haven't made up their mind, or they have told us that it may be until they get their insurance check, or when it'll be 6 months until I save, or I'm getting orthodontic insurance.
Yeah, there's some obstacle stopping them.
Some obstacle in the way. And we put them in that category so that we know to go back, and we'll put a time note on it.
Yeah.
And go back and send them just a hello again text. Hey, it's Dr. Dressler's office. We know you were waiting on your insurance. Is it taking effect? We want to know. We're here for you. We don't bug them. But we will follow up with that group just to try to see who of those might we get to start,
And you do this via text, and they're okay with it?
Via text, yeah.
That's good.
And you can attach a link to a YouTube video or whatever you want to do. You can do any of that. I mean, you can become as creative as you want from that perspective. But I think that's a good one. And then the other good one were what we have delayed starts, okay? Meaning these people said they were going to do it. They want to do it. They know their pay arrangements. They've accepted their pay arrangements. But
really?
For whatever reason, they haven't paid me yet, but they agree.
But they've done everything up to just paying.
To actually starting. And this could be something like, we've had an unexpected death in the family. My husband was laid off.
Yeah.
Those types of things. And we put them in the future starts column, meaning we know they're going to, when they overcome whatever obstacle got in their way, but they're further down the road than the potential new ones.
You made a very sophisticated sales pipeline for ortho practice. Hearing that as a marketing guy, it's great. You're doing
that's what we've done. And there. Now let me move to team. Okay.
Okay.
Sorry about that. But I thought that was important too for
It is, absolutely. If you're
these
running a
people.
practice, I highly recommend you segment your audience.
Yeah, yeah.
Getting started.
So in the team, I've got it's going to come automatically with every direct team member there. So it's going to have direct that's an individual communication with everybody that you have entered into the system as a team member of yours, doctors and staff.
Yeah.
Then I have an all staff and doctor communication channel. I have, if you will, you can create a doctor only communication channel. Then you can create, I have other things like supplies. All of my staff who are involved in ordering, put everything they order in that slot with how much we're paying. Because if I'm at a trade show and they go, hey, I've got a special on gloves, you can't, and I would say, well, I have no idea. I've got somebody who orders what gloves are. I now, from my phone, can log into Rhinogram, look up supplies, look up gloves, and go, oh, I'm paying this. How much is your discount?
Oh, you're able to pull that information up in the app?
Yeah, I can see it.
Oh, wow.
So it's really good to understand, am I getting a deal? Am I not getting a deal? And I've got it at my fingertips, what we're actually paying for everything. Likewise, what I have done, my insurance person handles all my credentialing and certifications. So I have her and I on a team, and each individual staff and her on a team, and we require everyone to take a picture and add it to their Rhinogram account of their continuing ed certificates and relicenses. So she goes in and can just look, and when she's filling out renewal paperwork, everything's at her fingertips. She can drag and drop those licenses wherever digitally, and it's a lot of help there.
And, well, thanks for sharing that. A lot of I'm sure a lot of doctors are thinking about how they have all these processes set up in their own practice, and you've got it down to a science. I think obviously you've been doing it for a while.
Yeah. Well, 4 years, and we keep adding new things. And I think the Rhinogram doctor community, and I use that word because we're in all of healthcare. Because what happens is we do have a super user page, and docs of, it can be a pediatrician, it can be an OB-GYN. They're sharing best practices with this group, our Rhinogram super user group, which everybody can be a part of if you're a Rhinogram customer, and they're beginning to see, and I've learned so much from others, and we put that into our platform or suggest it to our client base of how we can save you even more time and become more efficient,
Well, that sounds great. It sounds like a great program that really focuses on getting this efficiency up and saving time and money. So thank you so much for your time. Is there anything else you want to add before we wrap up?
If you would like, I know you're marketing. I would like to just quickly, very briefly, share within 2 minutes some of the ads, because I would.
Oh, yeah, if you want to do that, for sure.
Yeah, I would tell you that digital marketing is a must, and whoever you guys out there want to use, I know Ortho Sales here is a great company, and I really appreciate Richie having me on their marketing, and they can help you with these ads. But we also make them available so you can hand to Richie what it is that are most successful. So let me show you very, very quickly what we're doing during COVID. And again, it's just suggestions, but it's also things that actually work. And I need to be able to share my screen. Oh, here it is. Yeah. So
having a message that works right now, it's not a great time to be playing around and figuring things out.
This is one of our ads currently. You'll see it has the dates. These are Facebook and Instagram ads that are already scheduled here, and these will be the dates that they run. And what we're doing for COVID people is basically we're giving 20% off any treatment. Normally, I don't do much of this at all, but because of COVID, I do know coming out of COVID, people are going to be hurting financially. So I wanted to be able to offer something to these folks, but it's up to $1,000, and they must start treatment within 2 months of us reopening. This is a way that I can drive folks to us and set them up a time in the future.
Yeah, you have that sense of urgency. You have a good deal to kind of get people off the fence, and you're being empathetic to the situation. So that ad does all of those things.
Yeah, this ad here basically saying, hey, we are open virtually to you. We provide virtual exams and checkups with we highlighted free quote. This is really important because it'll differentiate you, because at the end of the day, the most common question you're going to get is, how much is it going to cost?
Yes, of course. That's what's on everyone's mind. That's why we make sure all the websites we build address cost, because people really care about that.
Yeah. And so we're out there and people are beginning to see all this. Here's another one, fit treatment into your life. Virtual orthodontics checkups creates fewer in-office visits. Again, I'm sharing with the world that I'm convenient too. Okay.
Exactly. You're expressing, you know what your differentiators are, and you're making sure they're in the app, sharing.
And I'm saying that, hey, why wait? Get a virtual exam with again, free quote today. Mm-hmm. Because if you say free orthodontic exam, well, every ad says that. I mean, you've got to have an ad that differentiates you a little bit, and that's why these work so well and have been proven. I will tell you, I don't know if the 20% off, if we haven't started them, it's April 13th, Monday. I don't know if that's going to do anything different or not, but these definitely drive value. Here again, the another 20%, and this is selfie in your smile. Mm-hmm. You can see. So these are what's coming in April to all of my social media. And as you pointed out, Richie, it is not that expensive to do this at all. But thank you so much for having me. And
thank you for being on. I really appreciate it. You shared some great insight for everyone.
Yeah, and thank you for having me.
Absolutely. Well, take it easy and stay safe out there, and have a great weekend.
All righty. Bye.
Bye.